Welcome to our deep dive into the essentials of respiratory and cardiovascular physical examination. This process is a cornerstone of clinical diagnosis, allowing healthcare professionals to systematically evaluate a patient's physiological status. The exam is divided into 4 interconnected components: inspection, palpation, monitoring of vital signs, and auscultation. Each step provides unique insights into the patient's health, helping to identify early signs of respiratory or cardiovascular disease. In this video, we'll break down each component, explain their significance, and guide you through practical assessment techniques. Let's begin by understanding why a structured approach is vital for accurate diagnosis and patient care. Inspection starts the moment you enter the patient's room. This initial visual assessment offers immediate, qualitative data about the patient's comfort, posture, and overall appearance. Look for signs of distress, pain, or relaxation. Notice the patient's build. Are they thin, stocky, or appearing wasted? Observe their posture. Is it therapeutic, or does it suggest discomfort or risk of complications? These observations set the stage for the rest of the examination, providing context for more detailed assessments. Remember, subtle cues in a patient's appearance can reveal acute issues or chronic conditions that require further investigation. Next, focus on the patient's face and neck for critical diagnostic clues. Facial expressions can indicate anxiety, pain, or confusion, while the color of the lips may reveal hypoxemia through central cyanosis. Watch for breathing mechanics like pursed lip breathing or nostril flaring, which often signal obstructive airway diseases. Move to the neck and check for the use of accessory muscles such as the sternocleidomastoid or trapezius, which suggests increased work of breathing. Also, inspect for jugular venous distension, a key sign of elevated central venous pressure or right-sided heart failure. These observations are essential for early detection of serious conditions. Now, examine the chest for structural and functional abnormalities. Assess the shape and symmetry of the chest wall. Look for normal ratios or signs of barrel, chest, kyphosis, pectus excavatum, or pectus carinatum. Observe the breathing pattern. Is it shallow, deep, regular, or irregular? Watch for increased work of breathing, such as retractions or indrawing of the intercostal spaces, tachypnea, and asynchronous movement between the rib cage and abdomen. These signs can indicate severe respiratory distress or muscle fatigue, often preceding respiratory failure. Careful observation here can be life-saving. Don't overlook the skin and peripheral extremities during your assessment. Check for pallor, excessive sweating, cyanosis, scars, or signs of pressure injury. Look for arterial insufficiency, which may present as dry, scaly skin, thick nails, or localized hair loss. Inspect the fingers and toes for digital clubbing, a hallmark of chronic respiratory disease. Also, assess for edema, swelling in the extremities, which can indicate heart or kidney issues. These peripheral signs often provide valuable information about underlying systemic problems, complementing your central observations. In acute care, patients often have multiple lines, leads, and tubes attached. It's crucial to identify and manage all connections such as IV lines, oxygen cannulas, feeding tubes, urinary catheters, surgical drains, EKG leads, and pulse oximeter probes. Before moving or repositioning a patient, ensure every line is secure, untangled, and properly placed. This prevents accidental dislodgement and maintains patient safety. Managing these logistical challenges is a key skill for healthcare providers, especially during patient mobilization or transfers. Palpation provides tactile information about the chest and extremities. For chest wall expansion, place your hands on the lower chest and ask the patient to inhale deeply, observing the symmetry and extent of movement. While this method is subjective, it can reveal significant asymmetries. For a more objective measure, Use a tape measure at the axilla and xiphoid process, though normal values vary widely. Palpate the extremities for temperature. Cold hands or feet may indicate poor circulation. Assess range of motion and strength, especially after surgery, and check for pitting edema by pressing on swollen areas to see if an indentation remains. Monitoring vital signs is essential for establishing a baseline and tracking changes during care. Key parameters include heart rate, respiratory rate, oxygen saturation, and blood pressure. These values respond dynamically to stress, activity, and positioning. For accuracy, ensure a calm environment, as anxiety can elevate initial readings. Know the normal ranges for different age groups, and be alert for values outside these ranges, which may signal acute problems. Accurate vital sign monitoring is fundamental for safe patient management and timely intervention. Let's break down the techniques for measuring pulse, respiratory rate, and blood pressure. For the radial pulse, use 2 or 3 fingers on the wrist, count beats for 15 seconds, and multiply by 4. The carotid pulse is stronger, but should be used cautiously, especially in new patients or during exercise. To measure respiratory rate, discreetly observe the chest or abdomen without alerting the patient, as awareness can alter breathing. For blood pressure, position the arm at heart level, apply the cuff correctly, and use a stethoscope to listen for systolic and diastolic sounds while deflating the cuff slowly. These skills ensure reliable, reproducible measurements.